Hello, my name is Kerry Lonergan and I work in public health. I'm here to talk to you today about cervical screening. So, what is cervical screening? Cervical screening is a method of checking the cells around the lining of the womb. Now, and this is called the cervix. And the reason we test this is to make sure that there are no abnormal cells growing on the cervix, to make sure that they don't then develop into cancer. Any woman between the age of 25 and 64 can be asked to go for a cervical screening test, and that's in the form of a smear test. So women between 24 and 49 will be asked to go every 3 years, and any woman aged over 50 will be asked to go every 5 years. You'll be sent a letter by your primary care trust or the local NHS and asked to make an appointment with your GP and or practice nurse to have the smear test done. You are allowed at that point, when you make the appointment, to make sure that you ask for a female doctor or practice nurse if you feel that's what you'd prefer. If you're happy with a male, then that's fine. You can state your preference when you make the appointment, but it's up to you. Most women will feel nervous about going for a smear test, and that's absolutely fine, but you shouldn't let this stop you from going. You should still make sure you go. When you go to the appointment with the practice nurse and or your GP, you'll be asked to lay down on a bed where they'll use a small brush to take some cells from the lining of the womb. That will be sent off to a lab for some tests to make sure that everything is okay. The results should be back within 2 weeks, so you should make sure that you get in contact with your surgery and find out your results if you don't receive them by post. There are 3 responses to that. You can have a result that's absolutely fine, in which case you will be called back again in 3 years and asked to make another appointment, or 5 if you're over 50. The second is that you might be asked to go for some checks because there have been some changes to the cells around the neck of your womb. These shouldn't concern you. It doesn't mean that you've got cancer, it just means that there are some changes that have happened to the cells, and that can be caused for any reason, including infection and inflammation, but they can be treated really easily in outpatients. And thirdly, you could be called back for a repeat test if there's an abnormal result. And again, this doesn't mean that you have cancer, it simply means that the test itself wasn't adequate enough on the first attempt, so a repeat has to be done. If this continues to happen, you might need to be referred on, but again, it's nothing to worry about.